Did you know PCOS is a common hormonal disorder among women of reproductive age, and it can have a significant impact on fertility and pregnancy? Hello, everybody. Welcome to today's Instagram Live. And in this month of September, we also know as PCOD Awareness Month, we've come up with a very important and informative topic for all of you. We girls have started, witnessing a lot of PCOD and PCOS hormonal issues at a very young age. But are we really taking care of that in an early age? Yes, no. But it actually hits us when we want to start a family. So today we're going to discuss this topic of PCOS, PCOD and its implication during pregnancy and for pregnancy. And for that, we have a very important and a very informative expert, Dr. Shivani Karnav, to shed light on this topic and answer all your burning questions. So just let me invite her here. Okay, Dr. Shivani. Dr. Shivani, a distinguished medical professional with an MBBS degree, is renowned for her expertise as an integrative OBGYN and her specialization in addressing PCOS related infertility. Hello, doctor.
Yeah, hi Kushbu.
How are you?
Yeah, I'm doing great.
Thank you for doing this with us today because, um, we all know most of us, like women of our age, have grown up with PCOS and PCOD, but it was
Yeah.
not a very talked about topic then. But
Mhm.
now people have started addressing, coming out in open and talking about it. Not as a taboo, but yes, we understand this is a hormonal imbalance and it
Mm.
has its own implication on pregnancy. And moreover, so most of the times women don't even realize that they are suffering from PCOS and PCOD until they want to start a family.
Yeah,
So, addressing the very important topic today, I have the first question to start off. What is
sure.
the connection between PCOD, PCOS, and fertility? And how does this affect a woman's ability to conceive? And what are the factors involved in that?
Yeah, sure. So PCOD and PCOS is the most common. Everybody agrees now. Like everybody know
Yes.
that nowadays PCOS is the most common reason for infertility, and it is the most common female endocrine disorder seen today in women. So it is actually not just a reproductive issue. It's not only related to the ovaries and the uterus. But we are going for treatment for this only. Directly, we are going for fertility treatments. So, what is actually why PCOS women is having infertility issue is because it is affecting the ovulation. Definitely, yes. But it is not only that, it is affecting our whole body from top to bottom, I should say. Every cell and every organ is affected with PCOS. It's not just a gynecological disorder. So, ovulation is getting affected. Why PCOS is causing infertility is ovulation is not happening, anovulation or delayed ovulation. So, because of this hormonal imbalance. Um, and it is like 80% of women with PCOS have fertility issues. It's not that every 100% women will have fertility issues, because to uh, say my history, I too had PCOS, but my condition was different. Like I had regular cycles and I conceived also, but little later. That is there. So 80% of women with PCOS affect with infertility, and yes, main reason is ovulation, and quality of egg will not be good actually
Okay.
in PCOS.
Also, ma'am, I wanted to ask one question. They say that, PCOS and PCOD, um, it's a natural cycle that every month the female reproductive system, uh, produces one octite from each side of the follicle. But in PCOS and PCOD, there are multiple octites, right?
Hmm.
what are the implications of, that? Like, every condition is different. Some have multiple octites, some have, fibroids, some have different issues. What are the implications of multiple octites?
Uh, okay, so you mean octites means cis, like you are calling
Yes.
them as okay. So actually, those are follicles. We usually, the so-called cysts are nothing but follicles.
Okay.
Inside of follicle, usually egg will be there. Yes, usually these cysts form because every month dominant follicle is not formed because of the improper rise and fall of the hormones, especially the LH hormone and estrogen hormone. So for this, the solution is not to go for laparoscopy and to drill those follicles, but to balance your hormones naturally.
Okay.
Yeah.
That was very insightful. Thank you for that explanation. Now let's talk about some proactive steps. So, since you're mentioning that we need to balance our hormones, are there
Hmm.
any specific lifestyle changes or treatments that one should consider before planning the pregnancy to optimize for a healthy planning, healthy conceptions, and a healthy pregnancy journey as well?
Definitely. It's a very good question. Actually, women with PCOS should not go for fertility treatments directly. It's a
Okay.
very big mistake. First, they have to optimize their health. Like at least for 3 months, they should work on improving their metabolism
Okay.
and balancing their hormones. So metabolism gets improved by reducing their insulin resistance, inflammation, and if they balance their hormones, even if they conceive, there will not be any complications during pregnancy. Like most common is miscarriage, and in the later pregnancy also there are so many complications. So yes, before planning for pregnancy, every woman, not only PCOS women, in fact every woman, because nowadays the lifestyle is so messed up, I should say. Yeah, poor. So that is my opinion.
Okay, thank you for that valuable information. Moving on, I want to move on to ask, what are the common complications and risk associated with pregnancy? Since you mentioned that,
Hmm.
during pregnancy also they may face a lot of issues, like
Hmm.
miscarriage is one of them, but in the later part also, if the pregnancy is going fine, but there's a lot of complications and risk associated with women who have PCOD and PCOS. And importantly, how can we manage those risks and how can those be minimized or mitigated?
Yeah, so this is a very good question to me because personally I faced complications during my pregnancy. Um, so apart from miscarriages, like miscarriage, we say when it happens around before 12 weeks, and sometimes pregnancy loss can happen in the middle of the pregnancy also, like around 5th month also. But compared to non-PCOS women, PCOS women have 3 times increased risk of diabetes in pregnancy, 3 times increased risk of hypertension, like preeclampsia, we call it in technical terms. And yeah, so more risk of preterm deliveries as well. 2 times increased risk of preterm deliveries.
Okay.
Yeah.
So, ma'am, I want to ask one question. Since you mentioned, it's not necessary that every PCOS female may be infertile or they may have fertility issue. So, I want to ask this question, rephrase this and ask this. Will every female who is conceived with PCOS or PCOD conditions will go through gestational diabetes or preterm delivery, or it's not the same? It may or
Yeah,
may not.
got it. So it's not like that. It depends on how poor their lifestyle is. Even if they get pregnant without optimizing their health, even after getting pregnant, if they follow healthy lifestyle, with respect to diet and exercise, of course, yoga and all, sleep and everything. It's not only with diet, but the total lifestyle should be good. Like basically, their metabolism should be good even during pregnancy. Like if they are wise enough to take care of their health even after they conceive, there is very less chances of landing up in diabetes and hypertension and all complications.
So, ma'am, I want to ask you one question here. They generally say that, once you conceive, the body's immunity level goes down to save the conception and, to provide all the nutrition and all the nutrients to the fetus inside your body, right? To the baby inside your
Correct.
body. Still, people nowadays we see that, this is a new term which has come up in last 5 years: gestational diabetes, hypertension. Preterm babies, yes, we've heard that before. But this has still come up, right? And a lot of people are able to manage hypothyroidism, hypertension, or gestational diabetes post pregnancy. But for some people, it kicks back. This temporary phase becomes permanent.
Correct. Yeah.
Although obviously all our gynecologists, all you doctors help us in delivering a healthy baby and do everything in your, in your hands to, get us through the pregnancy and get the baby out healthy and fine. But can you suggest few lifestyle changes that needs to be required during pregnancy and also post pregnancy, so that this temporary condition doesn't become permanent? Because nowadays we have so many mothers coming and telling us, we never had sugar, we never had diabetes, we don't have a family history of diabetes, but I had a gestational diabetes during my pregnancy, and suddenly I realized after 1 year of my pregnancy, or a few months after my pregnancy, that I have normal diabetes, like it's become I have been my hormone levels have changed, and now I have diabetes condition. So some tips for the mothers there.
Yeah, sure. So as I told, it's not only with the diet, but first I will tell about diet. So the modern diet is totally like westernized, I should say. Our Indian traditional diet is very good. It should be fiber rich, basically. So the food which we are taking is very less in fiber nowadays. So we should think about our gut health, gut bacteria. So we should feed our gut bacteria. Like at least 70 to 80% of our food should be good, rich in fiber. Remaining, that's okay. Occasionally you can eat. We cannot control because of so many tempting Swiggies and Zomatos and all. So that we cannot avoid. So at least make sure that at least 70 to 80% of your diet be natural and fiber rich and fresh foods. Avoid all those packaged foods and preservatives and all emulsifiers, all these things. Okay, I know like many women are fond of sweets like ice creams, chocolates and all, but I personally advise to avoid those and have home food, fresh food. So this is with respect to diet. And one more important thing is dairy. Coming to dairy and milk products, it's not that if you are pregnant you should drink milk, okay, glasses and glasses of milk you need not drink, okay, that's okay. Even like if you even drink milk, it is going to damage your it's not going to be a source of calcium, but it even absorbs the calcium, means it depletes the calcium from your bones actually. So it worsens the condition. So there are many sources of calcium in vegetables and all, so you can like research and choose them. Then, and it's not only about eating healthy, but when you eat is also important. That also affect your gut bacteria. So you should eat early, like before 7 or 8 p.m. Late night dinners also affects the metabolism of pregnant women. So the similar lifestyle, if they continue even after delivery, they will not get the over diabetes. And not only diet, overall lifestyle like physical activity, strength training, yoga, and especially stress, they should be able to manage their stress. Sleep is equally important. Yeah. So
Thank you so much for giving those excellent insights on diet, ma'am. Actually, it's been in our culture, right? The moment you are pregnant, I don't blame the family or the mothers or the mothers-in-law, but because they've seen uh, this as a tradition, or India has been a milk drinking country,
Yes.
right?
Yeah.
But
Like.
I think there is a lot of awareness now that the milk which we are drinking is adulterated, and so even if you're going and getting it from a goshala, the cow is injected with tons and tons of hormonal shots, and we tell this time and again, and thank you for redefining it for us. uh, we tell like a mother's milk is exclusively for the baby, and for the baby weans off after a point of time, the cow's milk is for the calf and not for
Exactly.
humans.
Yeah.
So please stop torturing the cows, and
Yeah.
ultimately the torture is not helping you, it is affecting your gut. And actually, and that is why we have so many people talking about gut flora and gut microbes.
Yes.
And we need not go to calcium for other sources. We have basic things in our house like til, right?
Yeah.
India has
Yeah.
this culture of having til ke laddus in winters, right? We
Yeah.
have a festival of Sakrat, like
Mm.
which you celebrate kite flying, where till is most celebrated and most used. We have things like drumsticks and moringa, which has become superfood now. But if
Yes.
you walk down the street of nearby your house, you will see one tree of moringa right there, which
Yes.
was always there. Now we're
Yes.
talking about moringa powder, but it has always been like in our
It's an
normal. You
iron.
get in a local sabji wala shop, you get drumsticks, right, with different names and different culture, different parts of India. So yes, like from first parents, I'm telling you two things. You don't need to research for the users.
Hmm.
Go to til, go to moringa, go to drumsticks. It's there in our old Indian food. You need not go to those supplemented things and jargon things to,
Yes.
take care of your calcium content. We have
Yeah.
raisins, black raisins,
Yes.
normal raisins, which we soak, good old soaked dry fruits and fruits we use.
Yeah. Yeah. Correct. Yeah.
So
I
coming
remember.
back to another question,
Yeah.
thank you, ma'am. So coming back to another question, there was a phase when PCOS or PCOD was defined for women who had weight issues. Doctors used to say, lose your weight and a
Hmm.
lot of things will be sorted. But I'm sure the doctors meant by losing weight is change your lifestyle along with
Yes.
food, exercise, and bring everything together, a holistic plan. But now we see that there's something called lean PCOS and PCOD. There are a
Hmm.
lot of females who are thin and they're lanky, but they are still suffering from PCOD and PCOS. And they come up saying that ma'am, I'm very thin, still I have PCOD and PCOS.
Yeah.
I know the answer to it, but ma'am, I would ask you to redefine PCOS, PCOD, because it doesn't need to, constrain it to, weight of a person, but it's a lifestyle. So can you
Yes.
redefine this for everybody once more?
Yeah, sure. Even for lean PCOS, so 80% will be obese. Only 20% will be lean PCOS. Like similar to diabetes, also 80% will be obese and 20% will be lean. But the reason is same. Like insulin resistance is same for obese and lean PCOS, and same lifestyle changes applies to both obese and lean. Okay, like except like fastings. So like obese women to lose weight, they need to do some extra fastings actually. Only that part they need not do, but remaining all will be same.
Yeah. So basically, we'll have to balance it. The whole thing with PCOS and PCOD is the hormonal imbalance of estrogen and progesterone, or
Yes.
more testosterone in your body, which
Yes.
needs to be balanced. Either you're obese or you're lean, and that's when you will be able to balance the entire hormonal imbalance of your body, right,
Yeah,
ma'am?
correct. So
Okay.
basically the insulin resistance, inflammation and hormonal imbalance, so these three will be same in both the obese and lean. So yeah.
So before we wrap up today's session, ma'am, could you've mentioned that you have been, diagnosed with PCOS, and then you conceived, and how it was for you. But could you share some more success stories and example for women who have conceived and who have had successful pregnancy with your
Hmm.
help? And because it's always encouraging to get real life stories, and then you don't feel that you're alone in the world.
Yes.
You feel, okay, this is, I am not the only one. You feel like,
Yes.
there with people.
Yeah. So definitely, so many success stories are there who conceived naturally, enjoyed their healthy pregnancy, and delivered normally. Many PCOS women, they land up in cesarean section because they are not so fit. Hormonal imbalance, uterus contractions will not be proper. So, but in my case, those women who conceived naturally with my treatment, they underwent normal deliveries, and babies were also so healthy actually. So to give example, so one of my patients, she was having night duties actually before she joined my program. So luckily she changed that and she conceived naturally. And she did not have any kind of symptoms during pregnancy. Like she was absolutely normal, and she was so thankful that she underwent normal delivery, and it was so seamless, the delivery and all.
Ma'am, one more question, one last question, which has come up to us in the question box is like, ma'am, I'm trying to conceive with PCOS, but because, my ovulation day is not fixed and my periods are very irregular, I am not able to conceive. I think this is the most common problem with a lot of people. They don't understand ovulation very well. Even after, having so many kits in the market for ovulation, um, I'm sure, the reason is not only ovulation, there may be quality of egg issues also.
Yeah.
But could you just answer that for us, ma'am, please?
Uh, yeah, so when your cycles are irregular, you cannot track your ovulation properly. It's so tough to track ovulation. So we have so many, like to say, gadget, not like you send some
Yes,
huh?
testing kits. Testing kits.
Testing kits, and some are there to insert in your vagina also. So
Okay.
that, because it is very tough to track ovulation, so that will give us digital information in the phone, like what is happening, how much is your LH level, when is your ovulation going to happen. Every night we can insert that, and we can sleep and we will get the information. But that is not all is required. What is required is to regularize our cycles first,
Okay.
to take action on our lifestyle. So once we get the cycle naturally, it will be very easy to track the ovulation. And initially they can try naturally without any ovulation kits or ultrasound scans or anything. But still, if they're not conceiving, we can go for proper follicular study scan so that we know proper egg size and endometrium thickness, how it is there. And accordingly, we can manage the condition.
So thank you so much for answering all these questions for us today, ma'am. PCOS and PCOD is a very common condition that many women face, and understanding its impact on pregnancy is very vital. We hope today's session has been informative and helpful for all of the people who have joined our session today. Remember, knowledge is power, and by being informed, you can take proactive steps to improve your chances of healthy pregnancy. If you have any more questions, please feel free to DM us or Dr. Shivani. We will be happy to answer any questions you have regarding planning your family, or not even planning, just to balance your hormonal levels and lead a healthy lifestyle. Thank you
Yes.
so much, ma'am, for joining us and answering these questions for us
Someone
today.
is asking some question. I think I need to ask something. Prithvika.
Yes, please ask Pruthvika. We'll wait for you to answer the question. Okay.
Okay. So
She has not replied.
not,
So, okay.
I'm not, yeah.
So we'll wait for you, Pruthvika. You can just DM us, and or you can DM ma'am. We'll help you answer your question. Thank you so much. Thank you. Bye-bye.
Thank you so much for inviting me. Yeah. Bye.